today's event is be focused on compassion. And I think we all recognize that we're practicing medicine now in an era with increasing fragmentation and to some extent maybe dehumanization. Well, one of my main mentors as a trainee was Henry Mencken. Henry Mencken's a well-known orthopedic oncologist, and he used to really speak of medicine as being a service to others. He gave analogies to us being like shepherds over a flock. And his engagement in patient care, his compassion for patients was truly a mark of his mentorship and was truly something that we should all emulate. I think at this point, we oftentimes become separated from our patients, sometimes in our preoperative evaluations, maybe as likely by Zoom encounters rather than an in-person encounter. Sometimes we may even forget major complications that we've had. We become separated from one another, and certainly with fragmentation within a department and growth of the department, we oftentimes, in the rare times we get together in person, we might not even recognize one another. We've seen that a couple of times. At this point, compassion and humanism is a major thing that we need to focus on, I think, and in being compassion and inclusive, this is a topic that our DEI group wanted to bring to the education of our trainees and our staff. I think a special part of this morning is we've got attendees who are obviously from the orthopedic department, from neurosurgery, from anesthesia. We've also, in this venue, we've got a lot of our trainees as well as our staff. Our speaker today is Jim Doty, and I've had the opportunity to learn from Jim in my own studies of mindfulness and compassion, and I've had a chance to meet Jim a couple of times now. Jim is an academic, he's a neuroscientist, he's an entrepreneur, and he's a major philanthropist. He's the founder and director of the Center for Compassion and Altruism Research and Education. This is out of Stanford University, and it's actually the Dalai Lama was the founding benefactor. Jim's a neuroscientist and is a leading researcher on the science of compassion. He's actually the editor of the Oxford Handbook of Compassion Science. He really works to promote thoughtfulness, connection, and to try and work with engaging our patients and ourselves in compassion and altruistic behavior. His research has been cited around the world. He's also a major entrepreneur. He's developed some major medical technologies, including a cyberknife. He's developed tools for intracranial monitoring, and he's recognized as an innovator and an entrepreneur. He's a philanthropist. He's founded health clinics around the world. He's created programs for disability. He's founded programs for youth who have been impacted by AIDS and HIV, and he's funded research programs at Stanford as well as Tulane. He's been a best-selling author, and I could recommend to you his book, The Magic Shop, A Neurosurgeon's Quest to Discover the Mysteries of the Brain and the Secrets of the Heart. He's also been an author of a new book, Mind Magic, The Neuroscience of Manifestations and How It Changes Everything, and that's coming out this May. He's got a lecture series called Conversations of Compassion, where he brings in some of the leading religious and spiritual leaders in the world, including the Dalai Lama, Sri Ravi Shankar, and others. And this Conversations lecture series has been translated into multiple different languages. He's the former chairman of the Dalai Lama Foundation. And again, his work with compassion has led to other publications, including a combined publication with Archbishop Desmond Tutu and the Dalai Lama in an international best-selling book called The Book of Joy. So with this as a background, Jim, it's a terrific pleasure to introduce you to our community. This is a community of healthcare providers that includes physicians, it includes medical staff, that includes people from orthopedics, neurosurgery, and anesthesia. And I introduce you to our community. I welcome you, and I thank you for bringing your knowledge and experience with compassion.
Well, thank you, Sig. It's really a pleasure to be here and actually quite an honor for me. And thank all of you for taking the time out of your day to spend with me. Before I start, I want to preface this discussion because sometimes you have speakers who imply that they have all the answers and somehow they have risen above and they now are perfect. And that's why they're on a platform pontificating about what you should be doing. And nothing could be further from the truth. The reality is I have been probably everything I have not wanted to be in terms of a physician, unfortunately. And the difference, I hope, though, is that when things are brought to your attention and you have self-awareness, then you try to improve yourself. There are two topics I'm going to discuss today. One is DEI, diversity, equity, and inclusion, and actually how on some level that's impacted the trajectory of my life, and also more specifically about burnout and the challenges for each of us in the healthcare environment in terms of building resistance. Building resistance is a good thing, but resilience is also a good thing. And how actually taking this seriously not only benefits you, it actually benefits your family, those around you, and most importantly, your patients. And oftentimes, the nature of the challenges of healthcare providers is that, one, the very nature of the organizations that we are in oftentimes are not the most compassionate and are focused on things that we feel oftentimes are not the most important things. And I think hopefully everyone would agree that the most important thing is taking care of patients. So to begin with DEI, I am a white male, obviously. And the reason I mention that is that oftentimes we talk about DEI, and frankly, the nature of our society is one which has been dominated by white males, and usually a privilege. My own backstory is somewhat different in that I grew up in poverty. My father was an alcoholic, and my mother had a stroke when I was a child, was partially paralyzed, had a seizure disorder, and was chronically depressed, and we were evicted from multiple residences. So certainly I have great understanding of the effects of poverty, and also certainly how marginalized groups are discriminated against from my own observations. And the reason I mention I'm a white male is that, for better or worse, that has made my path quite a bit easier. But I am acutely aware of that reality. So when we look at others around us, it's certainly, for many people, if it's a tribe which we feel comfortable with, oftentimes we connect with it and we feel it is supportive of us. The challenge is, though, if you're from a group that's in a minority or is discriminated against routinely, oftentimes you feel very uncomfortable. And the challenge for each of us is twofold. One is having insight and self-awareness about the biases that each of us carry, often unconsciously, but actually, in fact, have a huge impact on those we interact with. The other aspect is to have an understanding and appreciation, not only that everyone is suffering, but certainly that there are groups that have carried a much heavier burden oftentimes than many of us. And having compassion for that, recognizing their struggles, is really, really important. And it's important because when we feel accepted, when we feel non-judged, when we feel as if we're part of a team, magic happens. And what that magic is that there's much more cooperation, there's much more connection, people are much more efficient, and being able to bond together with diverse groups allows us to gain insight and experience that oftentimes is unique and in many cases quite profound. So oftentimes people make fun of, dismiss DEI programs, but I would strongly suggest to you that by doing so, each of us misses some of the greatest lessons we can learn in terms of our own humanity. So I would just like you to pause and think about that for a few moments. The other thing I want to talk about, of course, which Sig also referred to, is, if you want to call it, the power of compassion and self-compassion. As all of us know, there is an epidemic of burnout among physicians and healthcare workers, and it is profoundly affecting actually our patients. And it's affecting them because when there is burnout, when there is disengagement from your profession, as a result, this leads to medical errors, mistakes, and at the end of the day, the patient suffers. What's interesting is that there is an ever-increasing amount of evidence that by being compassionate, being kind, being thoughtful to those around you, and especially to your patients, actually leads to a decrease in burnout and very positive effects on the others around you, but just as importantly, your patients. Now, some of you who are maybe in the more administrative side of the house don't appreciate some of the things I'm going to say, but for the physicians and others actually involved in direct patient care, I'm sure each and every one of you has seen those physicians in the operating room who scream, they yell, they have this inflated sense of self-importance, and they make every interaction very uncomfortable because in their mind, they never make mistakes and everything is someone else's fault. I would suggest to you that a attitude which is somewhat different is much more effective and actually allows for a collegial relationship in the operating room. And one of the things that I do is when I see something going wrong or an event occurs, the first person I look to is myself. And by doing so, it decreases your anger because nobody wants to beat themselves up any more than they're already beat up. And the reason I say that is that when you can look inward and say, what is it I could have done? Did I not educate my team? Was there some misunderstanding? Did I not speak clearly enough? And you reflect on actions you can take, it's a much better environment for everybody. And I'm not saying to just arbitrarily take blame for everything, but what I am saying is a very important aspect is self-awareness and also emotion regulation. And emotion regulation is extraordinarily, extraordinarily important in our daily lives because many of the physicians, of course, know, and some of you listening may not appreciate that when you stimulate your sympathetic nervous system, your flight, fight, or freeze response, it actually acts as a short circuit to respond to threat. But in the modern world, oftentimes those reactions are not the most effective or best reactions in a variety of situations. So learning emotion control is actually very critical. The other aspect, in addition to, if you will, emotion control, is the ability to not be reactive, but to engage this part of our nervous system, our autonomic nervous system, called the parasympathetic nervous system, or the rest and digest system, which again switches you from this reactive mode to a much more thoughtful, self-aware mode where you have the choice of how you react, and you're much more thoughtful in terms of how those actions can affect other people. And a book by Viktor Frankl, Man's Search for Meaning. He's a psychiatrist who was imprisoned during the Holocaust, and he wrote extensively about this, but there's a quote attributed to him, which actually didn't come from him, but it's attributed to him, that states between stimulus and response, there is a pause, and within that pause lies our freedom. And what that means, of course, is that when you take a brief period of time before you react, as an example, if a mistake is made by a technician or a nurse or someone in the operating room, and pause for a few seconds and think about the situation and what might have caused it, or maybe you caused it, and reflect on that, that has a huge advantage to you. Because as soon as somebody is critical, as soon as somebody raises their voice, instead of being able to relax and be your best self and have access to that part of your brain, that executive control area in your brain, which is associated with your parasympathetic nervous system being engaged, when you do that, people are much more efficient, they're much more thoughtful, they're much more able to make good decisions, versus if one creates an environment of fear and anxiety, that is where mistakes are made. So as surgeons and other healthcare workers, it's really critical for you to take that pause and think about how you're going to react to someone. Now, I'm sure that many of you who work on the floor have interacted with physicians who are brusque, who are rude. They neither know your name nor any of the people who clean the bedpans or sweep the floors, and are dismissive of those people, unfortunately. And it's always fascinating to watch these people because, frankly, those actions are a clear signal that they are self-absorbed, self-centered, and actually don't care. Now, some of you listening may get upset or be angry because you're probably doing so because you recognize yourself. And I will assure you that everyone knows exactly who you are. And to be honest with you, they don't like you because you're a jerk. And some people might use the term asshole. I'm sure many of you are shocked by me using that language. I apologize to those who might be offended. But the reason I say that is that you can always tell the good doctors who take their job seriously and who, frankly, understand themselves, understand others, and how to be most efficient and get the most out of people and to inspire people. How do you do that? It's pretty easy, actually. You recognize the value of every person on your team. From my own perspective, I acknowledge and appreciate that my success as a surgeon isn't just about me. My success as a physician and a surgeon has to do with every person, and whether that person is working in the billing office, whether that person is with DEI, whether that person is the janitor cleaning up, every one of those people contributes to my success as a surgeon and a physician. And when you separate yourself from that reality, then frankly, you're deluded, and you separate yourself from everyone. When you scream, when you're demanding, when you clearly indicate that somehow you think you're more important than everyone else, again, it creates an environment which results in, for many people, fear and anxiety, or at worst, a confrontation. And none of these actions in any way contribute to improving patient care. So this leads me to another topic, which I have observed is a separation of many physicians from what I would call our professional responsibility to accepting a definition, oftentimes that insurance companies have given us, which is a healthcare provider. And what does that difference mean? Well, I'm not going to sit here and tell you that somehow I walked 35 miles through the snow to get to the hospital, and that once I got there, I took off my jacket and I was wearing my Superman outfit, and everyone loved me because I was so great. But what I will share with you is the difference in how perceptions are. Whether any of us like it or not, there was a period of time, probably spanning a few decades, where there was a movement in which everyone won. And what I mean by that was, this is the situation where there may have been a race, and the fact that you signed up somehow entitled you to be acknowledged for simply showing up. The reality, though, is that is not how the world works. For good or bad, there is the necessity for measurement. There's the necessity for recognizing the efforts of people. And when you create this narrative that we all are entitled, then psychologically, this creates a perception that your interests are more important than others around you, and that for just showing up, you should somehow be rewarded on the same level as the guy who showed up on time every day, who completed rounds, who visited his patients. And as a result of this, I believe there is a diminution of our stature as professionals. Nothing is more sad to me than to see colleagues, and oftentimes trainees, who somehow think that texting checkout is okay. What happens, of course, when you do these types of behaviors is that you somehow minimize and take away the emotional content or the humanity of oftentimes the patient, and categorize them into a few snippets of information that somehow the receiver is supposed to intuit that there is a human being at the end of this conversation. And it's not true. The most important thing that we can give to patients is to show up and, frankly, simply to care. There is an ever-increasing amount of data that demonstrates, one, when you interact with the patient and your eyes are focused on the computer, that in and of itself separates you from the patient and results in you not having an authentic connection. Now, what does that really translate into? One aspect of this is that I'm going to stop here because my computer keeps making noises, which is because I forgot to put it on Do Not Disturb. So forgive me for 1 second here. Okay. Well, forgive me. Now I can't remember what very deep and profound damn statement I was going to make, but I'm sure it was.
You're talking about making an authentic connection.
Oh, yes, exactly.
With our patients.
And the reason I say that is that when you're focused on a computer, obviously the patient knows you're not focused on them, even though you may be asking them questions and typing in information. How many of you have gone to a party and you meet somebody and they're looking over your shoulder to see who's more important than you? That is how a patient feels when you are interacting with them in this fashion. Now, I appreciate that healthcare is going in this direction. Sadly, I do not believe that the introduction of computers into the exam room benefit anyone other than the people who are charging for our services. But that is probably a debate for another time. I would also suggest to you, I was probably one of the lowest paid neurosurgeons because I never did that. Unfortunately, somehow there's a translation that regardless of what's wrong with the patient, that somehow in a half an hour, 45 minutes, we are supposed to be able to examine all of the hundreds of medical pages of medical records, the hundreds of radiologic studies, and do this and also come up with a thoughtful differential diagnoses and recommendations. And while that can be the case in many situations, it is not always possible. So then, as a result, what happens is there is this feeling or imperative that you have to do all of this work in a very short period of time and that it's not possible to do. And there are two aspects of that which are quite negative. One is that when you rush in this fashion, you actually are not taking the time to be thoughtful, deliberative, and truly understanding what is going on with the patient, unfortunately. And as a result, this can lead to missing certain clues, not doing a thorough job in reviewing the medical records, not doing an adequate examination. And of course, all of this is to the detriment of the patient. The other aspect, which I alluded to, is the actual impact that this has on the patient. Studies have been done, and I would refer you to an excellent book called Compassionomics for any of you who are interested. Studies have demonstrated that if you lean into the patient, if you touch the patient, if you actually give the impression that you're there to listen to them and that you're not rushed, it has a profound effect on, ultimately, outcomes. Now, of course, based on what I've told you, this should not be surprising, because when a patient comes to see us, they are filled with anxiety, fear, and oftentimes they're not even listening to what we're saying to them. In fact, studies have demonstrated that when you're counseling a patient, 98% of that information goes in one ear and out the other. And in fact, patients have even said when they've studied this that the doctor never even counseled them. And the reason is because they're sitting with fear, thinking about negative possibilities of that interaction or what is to come. The way to decrease that is through compassion. When you create an environment of psychological safety where you are able to calm the patient down, when you're able to sit with them, where they feel that there's an authentic connection between you, what does this do? Again, it's what I talked about earlier. It shifts them from the threat mode to one of the engagement of the parasympathetic nervous system, which is this rest and digest system. When the patient is in that situation, physiologically, they're calm, their heart rate's lower, their cardiac function's improved, their immune system is boosted, the expression of inflammatory proteins is decreased, their stress hormones, such as cortisol, are decreased. So what does that translate into? When you're able to give that to the patient, that gift of presence, then it leads to them feeling comfortable. It leads to them not having anxiety. And how does that translate? One, it translates into decreased anesthesia in the operating room. It translates into the decreased necessity from narcotic analgesics post-op. It leads to decrease in length of stay. It leads to improved outcomes, and it decreases the readmission rate in 30 days. And what did that cost? Zero. It cost absolutely nothing for you and for each of us to act as a professional, not as a healthcare provider. And this is very, very important. Now, there may be a subset sitting here listening who say, this is BS, that, my job is to get in and out, and I don't need to see the patient. That's for the nurse practitioner or the PA, and my job is to be, quote unquote, a surgeon or whatever definition you're using. The fact of the matter, with that type of an attitude, you're neither a good surgeon nor a good physician in any way, shape, or form. And being in this delusion that you are not only is a disservice to the patients and those around you, it's a disservice to yourself. So I would say that, and what I have had to do, is to reflect on who I want to be and how I see myself. Now, the reality is all of us are imperfect and fail, but that doesn't negate the fact that our goal is to create a thriving environment, not only for everyone around us and our patients, but for ourselves. And when you live in this delusion of how important you are, everyone knows it. And sadly, your children know it, your spouse knows it, and many of your friends know it. Now, this doesn't mean that you can't get along in life, but what life do you want to get along in? Do you want to be admired and respected by those around you? To be looked at as an example and a role model that others try to emulate, or to be used as an example of what not to be? And these are not insignificant matters. These are matters that define our humanity. Who do you want to be? And why do you want to be that? Frankly, if you look somebody in the eye and ask them, I would assure you that almost 100% of people would say, I want to be the person that inspires other people. I want to be the person that people look up to. I want to be recognized by those in the OR as not only a nice guy, but a good surgeon who creates an environment for everyone to be their best. I want to be looked to is, okay, are we recording again? Damn it. You're interrupting this profound damn talk I'm giving. Anyway, the reality is that all of us want to be admired and respected. And we should not stand in the way of that happening. But to be that person, we have to be open, we have to be self-aware, we have to accept criticism and understand that is only through this path that we can become the best person that all of us, I think, want to be. Let's see, how long have I been pontificating here?
Jim, this has been terrific. I think we're going to try and go for another 20 minutes here, and I wonder if we could make this a bit interactive as well, because you've really made some terrific points and shared with us with some humility as well as insight as a surgeon into some issues I think we all face, and we all continue over lifelong learning to try and improve. One of the things you talked about, and if we make this a bit interactive, is the gift of presence and kind of engaging our parasympathetic nervous system. The gift of presence oftentimes requires time. And you said earlier that a challenge of our healthcare system now is the fact that the organization itself isn't necessarily compassionate. The infrastructure we work with in EMR, the volume of patients that we deal with, the volume of information each patient brings, sometimes that's so difficult to really engage with that kind of presence. And can you share with us what you've learned about how to be more present, how to get away from entering information to the EMR, looking at x-rays, and actually focus on touch and focus on eye contact, focus on real engagement?
Well, you bring up an extraordinary challenge in the present healthcare environment because, one, as you noted, oftentimes these organizations are neither kind nor compassionate, and they translate who you are into a productivity number. And as a result, you have financial analysts, or some of us say bean counters, who are determining how you are to practice medicine to maximize profit for the institution. And this is a fundamental detriment to all of us in the healthcare environment, and especially to our patients, because it limits our ability to truly care for them by being present. Because, as an example, I'm sure, Sig, you probably experienced this, and I'm sure many of the residents and faculty do too. You have your chairman, come to you with some report that says, well, your RVUs are not up to snuff here. You're not as productive as you should be, and XYZ is going to happen. And this is, unfortunately, a reality. And for many physicians who care, this is a form of moral injury. And because our goal as physicians is to do the right thing to care, and when we're prevented from that, this sense of us having been trained to do a job and being prevented from doing that job causes a great deal of suffering. And the reality is, while we can talk about mindfulness practices, we can talk about collaborative workplaces where we support each other as an aid to overcome some of these issues related to burnout. These are Band-Aids. And until we get together as physicians and healthcare workers and demand a change, it is not going to happen. Now, I'm not trying to be pessimistic, but I think most listening would agree that that's the case. Well, how do you do that? I think we have to be better advocates for ourselves, and just as we need to do in terms of diminishing burnout by putting boundaries around our behavior, I think we have to put boundaries around the behavior of those that interfere with us being doctors. So I think that's an important point, but obviously that's a challenge. In terms of the EMR, nothing is more irritating to me, and I'm sure many of you have experienced, where you have people who are gaming the system to get higher RVUs who will like walk into the room, look in, walk out, and then you'll see they just repeated for the 50th time the same goddamn note that has been there, when in fact you know they didn't do squat. I see some people smiling. Maybe you appreciate this. But, this is what people are forced to do, unfortunately. And it actually makes medicine much more inefficient, because I'm sure many of you have experienced the reality. You go in to look at a medical record to figure out what's going on, and it is the same damn note for the last 2 weeks. And you're trying to read between these lines to figure out what the hell actually happened here. And it's very, very challenging. And in no way is it helpful or efficient. And all it does is fulfill a requirement that has been arbitrarily made that offers no benefit in terms of patient care. That's my diatribe on EMRs at the moment. So anyway, I'm not sure if I answered your question. I'm just pointing out, though, some of the things that are extraordinarily irritating and make our lives less efficient and actually impede patient care. Because as surgeons know, and now don't get me wrong, oftentimes their writing is horrible, as many physicians are, but as surgeons know, usually the note that we write has the minimal amount of information necessary to be useful to understand what's going on, versus going through all these vital signs for the last month and all this minutia that is irrelevant to the decision-making process oftentimes. So,
Jim, your insight and your experience as a surgeon, I think, resonates with a lot of us on the call, perhaps all of us. One of the points you made is moral injury. We had one of our residents give a very good grand rounds recently on the concept of moral injury, and we're an RVU-based system. I think we've all experienced the notion that our value is largely determined by our RVU productivity. Certainly economically it is. And to that end, one of the things we've struggled with as a department is how do we reward other things? How do we reward engagement in educational activities? How do we reward engagement in patient care, engagement, having a presence? How do we award the ability to evoke the parasympathetic response? Because in some ways that is the moral injury, right? Is that's almost at odds with an RVU-based reimbursement system.
Yeah, and as I'm sure you know, there's a subset of physician who knows how to manipulate that system ruthlessly for their own benefit, and usually are narcissistic assholes. But I shouldn't say that probably. But yes, there should be other ways to gauge behavior. And it's not all about efficiency, at least in the context of the way the system is designed. It has to do with what do others think of you in your interactions, because that's very important. if you're perceived as a role model, if you're perceived as a person who makes other people's lives better, where you actually take the time to interact with them, where you feel it's important to be an educator, whether you're getting paid or not, where you take the time to share your knowledge with other people, where you take that extra time to check on a patient before you leave, or where you call in about how the patient is doing. The nature of being a physician is not telling the PA not to call you at night. That is the antithesis of being a physician. If you're on call and you have agreed, it is your obligation to show up, to be present, and be kind. Again, having been chief of a variety of services, I cannot tell you the number of times where I have been called, where a physician gets called by the ER and they will spend 20 goddamn minutes arguing about why they don't have to come in when it would have taken less time for them to come in. And it is the most bizarre thing in the world. If your job do X, then you need to do X, and not somehow think that you are so important that a less trained person who doesn't have the experience is somehow supposed to make the right decision without any interaction with you. It is ridiculous and it's dangerous.
Jim, we got about 10 minutes left. I want to invite other questions because you touched on so many important topics. One of them, Rosie Woostruck, is one of our tumor surgeons here, one of our orthopedic oncologists, and she's asking, is there any data about burnout that might be different in an RVU-based system versus a salaried system? So, for example, some hospital systems, the Mayo, the Cleveland Clinic, are salary-based, Kaiser rather than RVU-based. Is there any data that looks at burnout rates and perhaps engagement rates, presence rates, and different fee-for-service type structures, different reimbursement structures?
That's a good question. I don't have an answer to that. Typically, though, I would say that while there are quote-unquote salaried positions, usually there is still a bonus that is still associated with some degree of productivity. What we do know oftentimes is that, and this is a sort of balancing on the knife's edge, right? If you basically don't have specific requirements for productivity, there's a subset of people who will avoid doing any work whatsoever. And in fact, unless they're reimbursed for surgery, they will find every reason not to do surgery. And this is reflects the capitation system that has been popular. And I think the data we have from that probably in many ways reflects the reality of the question you asked. So there does have to be some sort of balance between what is necessary and what isn't, and that allows people to have the ability to make some of these decisions. You know, it fascinates me, to give you an analogy. I'm sure you've been to an auto mechanic. It fascinates me that they'll have a thing on the board that says an oil change takes 4 hours, yet half an hour later they have your oil changed, right? And so this is sort of the opposite. They're charging you for something that doesn't take that long, and we're sort of in the opposite situation. We're penalized if we take too long. Any other questions?
I'd like to encourage others. Jim, I mentioned in the introduction that you're accomplished in so many areas. You've been a neuroscientist, a leader in compassion research. You've been a philanthropist, and you've also been very innovative as an entrepreneur. And I've always enjoyed the anagram of reactive and creative. So you had warned us about being reactive and finding our freedom in the pause between a stimulus and a response. How has avoiding being reactive helped you in being as creative as you are? Because, again, your innovations have been terrific.
Well, to be frank with you, it's because I don't care. And what I mean by that is I have a moral compass, and I don't need external affirmation to tell me that I'm okay. And I don't mean that in an maybe it is an egotistical neurosurgeon type of way. But what I mean by that is many of us on this call have been in situations where we had an idea, a belief that something is possible, and we'll share that with others around us. It can be family, friends, colleagues, and they'll be some of the first people to say, no, that's not possible. Don't waste your time. And that's what I mean by that. When you listen to everyone who tells you no, that is the most horrible thing that can happen to you. And in fact, this is the nature of self-agency. Each of us here has an immense amount of power within ourselves. And the problem for so many people is that they give that power away by looking for external validation. And in some ways, this relates to the nature of happiness. Many of us have bought into the belief that success equals happiness. Success, defined by Western capitalist society, is money, power, and position. And if I just have that, I'm going to be happy. And the reality is, and I can tell you from personal experience, you climb each of those mountains and there's nothing there for you. Because for me, I was always seeking this outside affirmation that I was okay, or to overcome my own insecurity or fears, and it did nothing. The only liberation was for me to understand that only I can give myself happiness, and that comes from a deep-seated sense of meaning and purpose that each of us has available to us, and that is a life which results in deep-seated happiness, not transitory happiness. Although I will preface this by saying that I like to drive Ferraris and Porsches at times.
I want to open to other questions. Jim, your Center for Compassion and Altruism Research, you sponsor a number of workshops on developing compassion within organizations, compassion for self. And I wonder if there are any of your workshops that you may recommend to our group. Our DEI committee is actually working on developing some alternative educational venues. And are there any of your workshops that you think specifically would be useful for a surgical department?
Well, I would say that all of them are malleable. We have certainly programs for healthcare workers, physicians, first responders. We have actually programs which may be relative to the DEI aspect for police officers as well, to decrease bias and to give insight into unconscious aspects of behavior that actually can create situations that are challenging for people. Again, nothing is more offensive to a subset of people than a belief that somehow their privilege is being taken away from them. And creating a situation where people understand that they have privileges which they take for granted and somehow feel they're owed can be very traumatizing for a subset of people. So being able to effectively communicate that and have people understand the importance of these types of programs, I think are very, very important. So we can create programs that can be 2 hours a week for 8 weeks with some exercises in between. They can be a weekend program. They can be a 4-hour program. Anything is possible.
Jim, just a few minutes left here. I think Rosie has her hand up. Rosie, did you want to bring in a question?
Oh, sure. Thank you so much. I really enjoyed this time talking with you and listening. What's one thing all of us could do today, small thing that would improve the environment in which we work and compassion?
Well, Yeah, I'll tell you something that I do every day, and you can take it for what it's worth. Sig referred to a book called Into the Magic Shop, A Neurosurgeon's Quest to Discover the Mysteries of the Brain and the Secrets of the Heart. That's a bestseller in 8 countries, as well as New York Times bestseller. I'm not saying that to promote myself, but maybe I am. But in that book, I talk about something actually, and it related to talking to a group of incoming medical students. I'm sure you probably have the white coat ceremony. And all of us in medicine have to remember a lot of facts. And one of the ways we do that is a mnemonic. And what I do every morning to center myself is go through a 10-letter mnemonic. But it is combined with a brief breathing exercise, which, as some of you know, you can shift from this threat mode to engagement of your parasympathetic nervous system by a breathing exercise. So I sit at the side of the bed doing a breathing exercise to put me in that mode. And then I do 2 things before I use this mnemonic. Some of you may have read a book called Awe, A-W-E, by Dacher Keltner. So I sit for a few moments and think about the awe and joy of being in this world. And then I go through this 10-letter mnemonic, which I created for the incoming medical students to center them not only as physicians, but as human beings. So that mnemonic starts with C and ends with L. So I go through this, like I said, every morning. C, compassion for self and others. D, recognizing the dignity of every person. E, practicing equanimity, this idea of evenness of temperament, understanding that, there may be events that we are grateful for and they make us feel good, but there are also events that make us not feel so good and are painful. But all of these are transitory. And being able to maintain this evenness of temperament is in some ways related to emotion regulation. F is forgiveness. I'm sure some of you have had colleagues who are complete jerks, and you get angry with them. And the problem is every time you see them, you carry that anger with you. And it's like drinking poison, somehow thinking that by doing so, that's going to affect the other person. It never does. So you need to not forget, but to forgive them and not carry that emotional tension within you when you see them or think of them. G is having gratitude. That is one of the strongest activities to improve your emotional state. Having a gratitude journal as an example. H, which is the hardest for neurosurgeons, of course, is humility. I is for integrity or values that bound your behavior. J is justice, in the sense that our responsibility as healthcare workers, as physicians, is to care for those who are vulnerable and to be their advocate. K, of course, is the simple act of caring for another person, kindness, and all of this is contained by love.
Jay, that's a terrific conclusion there. That's a wonderful acronym, a wonderful practical tool we might bring. We've got to wrap this up, but having said that, I hope we'll have another opportunity to hear from you. I'll send out some of the references that Jim mentioned, including his 2 books on magic. And Jim, thank you so much for sharing your experience, your insight, and for bringing compassion to our day in our department.
Well, thank you all. I appreciate it. You all take care. And if I can help any one of you, give me a shout, and I'll do what I can. Okay.